Let's talk about a different F word: fatigue. My name is Paul, and this is Paul's Heart. I'm author of the book, Paul's Heart: Life as a Dad and a 35-year cancer survivor, available on Amazon. Fatigue is one of the most common and most frustrating parts of cancer treatments and survivorship. And I would even go as far as to say it's harder to cope with than any pain because, at least with pain, it can be medicated, while fatigue affects nearly every aspect of life: the body, the mind, emotions, and even our sense of identity. Fatigue can happen at any stage of cancer or survivorship. During treatment, fatigue can be caused by any of the following: chemotherapy or radiation treatments, anemia, which is lowered red blood cells, poor nutrition, weight loss, sleep disruption, pain, stress, anxiety, and just the overall demands of fighting for life. Even after treatment, fatigue can still persist. The body needs time to repair from all the damage caused by the treatments, and this can take months, even years. Heart and lung problems can contribute to the fatigue. Hormonal problems, such as with the thyroid, chronic inflammation, depression, anxiety, PTSD, post traumatic stress disorder, and normal aging, are all mentally exhausting. The common question asked by nearly everyone is, how long does this last? And honestly, there is no one answer. Many people can recover within 6 to 12 months, while others can take several years, usually battling some of the intermittent fatigue, the good days and the bad days. Even 37 years out from Hodgkin's lymphoma, I still battle fatigue every now and then as a long term effect from my treatments and various health conditions that I deal with. So, why is fatigue so hard to get over? It's because it's not normal tiredness. Okay, sleep doesn't make it go away. It can appear suddenly, even with the smallest of efforts. Mental concentration and memory can be hindered. We sometimes remember this as chemo brain or brain fog. And it's frustrating because on the outside, we look fine. And those looking at us can't understand why we feel so bad and why we just can't push through it. So, what helps? Well, you do as much as you can, when you can, if you can, and if not, that's okay. You stay as physically active as you can with gentle exercise, such as walking. Pace yourself. And let me repeat: pace yourself, alternating activity and rest on your good days instead of overdoing it. Wow, I feel great today, I'm going to do all this. No, don't. Get good sleep. Eat right. I know, the obvious stuff. Don't be afraid to ask your doctor to look at medical issues, such as testing for anemia, thyroid conditions, vitamin deficiencies, cardiac issues, or medication side effects. And a big one that I occasionally struggle with: managing stress, whether through mindfulness like meditation or, practicing Buddhism, stuff like that, counseling, or support groups. And lastly, this is important: accept that your body's limits may just be different than they were before you had cancer. But there's one message I want you to listen to: fatigue is not weakness or laziness. And I'm going to repeat that. Just because you are fighting fatigue does not make you lazy or weak. Okay? Fatigue is a real issue. It's a biological consequence of your cancer and the treatment. So much pressure, and usually futile, to get back to who you were before the cancer, to building a fulfilling life around the body that you have today. Many survivors find that once they stop measuring themselves against their pre-cancer energy level, and instead learning to work with their current abilities. Only then does fatigue become more manageable emotionally as well as physically. Until next time, this is Paul's Heart.